So I'm Dr. Kaarina Kowalec, an assistant professor at the College of Pharmacy in the Rainey's Faculty of Health Sciences at the University of Manitoba. I mostly do research and also teaching, and so I do research in the areas of multiple sclerosis and schizophrenia. And in my teaching arm of things, I teach PharmD students, which are students that are going on to become doctors of pharmacy. My research is in an area called precision medicine. So basically, we try to find ways of using people's genetic information to guide either drug prescribing or to guide whether or not someone's going to have risk of like a bad outcome or risk of things like suicide or of early mortality or things like that. So it's sort of this idea that not one size or one idea fits everyone. So most public health and health measures are made for populations, whereas we know that each individual varies quite a bit in terms of whether they respond to a drug or what the risk is of having a bad outcome. So this is just a way of essentially taking personalized medicine, which is really what is already done nowadays with a doctor and a patient, and taking it to the next level, which would be precision, which would be using more pieces of information that we haven't in the past, like genetic information, and also can be extended to other things like protein levels or even more precise things like that. So I think a lot of times it's not known sort of even what type of research is going on in Manitoba, but the type of data that they have in Manitoba is really unique in Canada and also even around the world, and it's something that I think that hopefully people will come to know more as time goes on, and hopefully even the research that I do, if I can communicate it to more people, I think the better it is. The research is only as good as it gets into the hands of people that actually need it, and so I think that's something that's really unique about Manitoba is the type of data that we have here, and also even the expertise as well. There's a lot of expertise in MS and also in psychiatric diseases too. I really hope that one day we can get to the position where if someone comes into a clinic, and they're diagnosed with some kind of severe condition like MS or schizophrenia, that we can tell them, okay, you're obviously diagnosed with this disease or disorder. We're hoping that we can tell you kind of what's going to happen to you. Hopefully give them some peace of mind that, this is, you need this treatment because that'll give you better odds of having a good outcome. Or you should avoid this medication, or you should avoid this type of treatment plan because it just won't work based off of your personal kind of makeup. So that's kind of hopefully where I hope it'll go.